Okay, welcome everybody. Thank you for joining us. So welcome to today's Big Data AI Hub seminar. As you are aware, the purpose of our seminar series is to connect researchers, industry professionals, and students to engage in discussions about recent developments and challenges in the fields of big data and artificial intelligence. This is the first session in our spring 2024 series, and I hope that you will continue to attend what are promised to really all be great sessions. For today, I'm delighted to introduce our speaker, Natalie Szudy. Natalie is the Interim Executive Director for the Digital Health and Discovery Platform, with a rich background in managing pan-Canadian health networks and expertise in translating research into healthcare solutions. She holds a PhD from Western University, along with certifications in ethics, design thinking, change management, and knowledge translation. Today, Natalie will present on accelerating precision medicine for Canadians through big data and AI. This talk will explore how the Marathon of Hope Cancer Centers Network is leveraging data and AI to revolutionize cancer treatment, moving us closer to personalized care and fulfilling Terry Fox's dream of finding new cures through research. Natalie, thank you for the wonderful work that you are doing for the betterment of Canadians, and thank you for joining us today. With that said, please join me in warmly welcoming Natalie to our seminar. Thank you.
It's great. Thank you so much for that wonderful introduction. I will have to say that I am a member of the Terry Fox Research Institute team. And so although I'm sharing information about both the Marathon of Hope and Digital Health and Discovery Platform initiatives today, I would acknowledge that a lot of work from the teammates go into supporting these initiatives. And so I'll mention a few throughout the presentation, but just wanted to also acknowledge that it's truly a collaboration, and really a collaboration that I think is the key to success when we're talking about precision medicine and moving forward these wonderful initiatives. So I have a few slides to go over today that will outline both the Marathon of Hope Cancer Centers Network and the Digital Health and Discovery Platform. And I think we'll reserve some time for questions as well. I can see a few on the screen right now as I'm in my presentation mode, but I'll take the slides down afterwards and we can ask questions and have a discussion. And I look forward to that part of our session today. So I wanted to start just by giving a bit of context about the vision for cancer research and what the Terry Fox Research Institute is supporting through all of their work. And so the Terry Fox Research Institute primarily has a function where they support translational cancer research. So that's funds that are provided to research teams all across the country to support innovation in cancer research. Throughout the funding of research projects and really supporting innovative research across the country, the Institute realized that there was a need to also support the development of data and also technology that would enable the sharing of the data. You're probably very familiar that there are a lot of challenges and barriers that are in place when it comes to sharing data. Barriers that exist across the country between provinces, but also even within provinces. And I'll give you some examples of some of the work that we're doing to help address those barriers and really allow for the use of data across the country. So part of the vision that I have outlined on the screen is also to support diversity and work across healthcare access. And so this is another piece that both of the initiatives help to support in different ways. And so I'll talk about Marathon of Hope Cancer Centers Network. I'll use the acronym MOHCCN. As you can imagine, it's a mouthful as I say this repeatedly through the slides. And then the Digital Health and Discovery Platform, or DHDP. If I inadvertently slip into any acronyms, please feel free to stop me. There's a lot, I'm sure that there's a lot that you're familiar with, and sometimes they don't mean the same thing, so I'm happy to go through them if it comes out. I'll try my best not to, though. So as I mentioned, that the Terry Fox Research Institute, in addition to supporting cancer research, and so there are funding competitions that they support, there are two initiatives that are pan-Canadian projects that are being supported currently. And they're being funded through different mechanisms. So Marathon of Hope Cancer Centers Network, MOHCCN, is supported by Health Canada. And it is an initiative that is all around developing what we call the gold cohort. So that's the data side of the projects that are being supported. The other initiatives is the Digital Health and Discovery Platform, or DHDP, and that is building a technology to help the sharing of the data that Marathon of Hope would contribute, and also other health initiatives would contribute. That is supported by the Government of Canada through the Innovation, Science and Economic Development arm. And so that initiative also has a commercialization component to it, and I'll go into that a little bit more in depth as we talk about each of the initiatives. I will start with the MOHCCN, and I wanted to also first start by acknowledging the connection to Terry Fox Marathon of Hope. I'm not sure how many of you on the call are familiar with the Marathon of Hope. I know that I participated in Terry Fox runs when I was in school, growing up in Toronto, and I'm still very much a part of volunteering to support Terry Fox runs and events across the country. But what the Institute wanted to do is they wanted to connect the Marathon of Hope and what Terry's goals were in uniting Canadians all across the country in support of cancer research by uniting patients, researchers, clinicians, hospital administrators, all of them in a goal to help accelerate precision medicine in cancer. So if you look at the Marathon of Hope website, you will see also there's a connection to what we're calling the Team Canada of Cancer Research. And so this is through this initiative, we're bringing in collaboration from all of these different parts of the health ecosystem to bring together this unified approach. It's really based on the acknowledgement that there's no one single cancer center in the country that has a large amount of data to make it a reality where you could be executing research on precision medicine or implementing precision medicine. There's pockets of data that exists all around the country, and some cancer centers in the larger cities, for example, have good resources that they've applied to develop a data set to help precision medicine. For example, in BC, there has been a lot of effort in developing a personalized oncogenetics program that has shown quite a lot of success in treating patients or identifying different forms of treatment for cancers that are beyond what has been the standard of care. And so in using these types of examples of the little work that's happened in pockets all around the country, this is the vision of Marathon of Hope. To really extend capacity and to help the smaller cancer centers that may not have the ability to have a rich data set, may not have the ability to have the technology resources to allow them to access data or technology to help inform the care for the patients that they are serving. So the Marathon of Hope, or MOHCCN network, has been operating for several years now. There was an initial 5-year timeline or roadmap that was set up for that initiative, but due to the pandemic, we're technically in year 3 because we've been able to extend our deadline so that we could complete the work. So on the screen, I've put 4 key deliverables that have been achieved through the work. And this is where I want to reinforce the comment I made at the beginning of today's presentation, that really acknowledging the work of many individuals in helping to achieve these deliverables. And a lot of it has come from researchers and clinicians and patient partners who have volunteered their time to participate in this initiative. So the very first point, and one thing that we needed to put in place to support the MOHCCN, is the development of a structure. So we had to develop a governance structure, a network structure that would help bring groups together to start to work on some of the key elements that we needed to support a development of a data set. So we've had within the cancer research community, there has been a long history of collaboration, and that's been acknowledged. And that's, I think, one of the key founding parts to the Marathon of Hope that's made it a success as it is today. What we were doing is we were now trying to broaden that and bring in more researchers and clinicians from smaller centers to involve them in the discussion, but then also to identify differences that exist across the country. And we've seen through our conversations and our work with these individuals that there are a lot of differences between a large healthcare institution and a smaller healthcare institution, and ways that patients experience cancer care through those institutions. That's led to the development of a pan-Canadian network where we have representation across the country. And you'll see on the slide in a few minutes here when I'm talking more specifically about data, we also want to mimic that representation through the data that's being collected for the GOLD cohort. That leads us to the next point on the screen about the GOLD cohort. So the initiative has a target of developing 15,000 cases, which pairs genomic information with clinical data. And that is what makes up the GOLD cohort. There's been a few initiatives that have been put in place to help collect the data. We realized very quickly that some of the centers had data already in place, and we call them our retrospective cases. So this is data that would have been collected through studies that were done at each of the centers. And what we were doing is we were funding the genomic sequencing, or the sequencing of genomic material that was collected through that study, so that we could have a pairing of the genomic information with the clinical data. This is a key innovation and a key feature of the GOLD cohort. The next piece, and I'll talk about this as well a little bit in more detail, is how we were also setting the path for sharing data. So I mentioned in the beginning that there are barriers to sharing data. There's barriers that exist at multiple levels. There are federal restrictions, provincial restrictions, institutional restrictions. And so what the group has been doing that's been tasked with this is to look at ways that we can share data. What are our policies that we have to have in place? What are the privacy and security mechanisms that we would need to have in place in order to make sure that privacy is protected, there's a high level of security, but then also to enable the sharing. And that has been a lot of challenging conversations, because you don't want to be too much on one side, and you're bringing a lot of individuals to the table to negotiate ways that we can move forward. So I wanted to go into a little bit more detail about what the GOLD cohort means. And I have on the screen a little visual of a person, and we've affectionately nicknamed this Casey. This is a case. And so what you see on the left-hand side is what it means to contribute a case to the GOLD cohort. So you need to have genomic data. So that's taken from tissues, for example, maybe from a tumor. You also need to have clinical data. And the members of the network have come together to develop standards around how do you collect the tissue, what's the best way to collect and sequence that genomic information, and what's the best way that we can then take that data and make it shareable. On the other side, on the clinical data side, there's been a group that has come together to work out what's our clinical data model. And right now, we're in version 2 of the data model. We have over 190 fields of data that are clinical data that are extracted from the electronic medical record, or EMR. You'll see there the target again, 15,000 cases, and we want to make sure that we have inclusivity, diversity, and equity represented through the data that's being collected. We have already identified, though, that there are gaps within the population from the data that's already been collected. And those gaps are caused by various reasons. I talked a little bit about retrospective cases that we have collected, so data that was collected a long time ago that we're able to contribute. Those might have been targeted on specific population groups. There are also population groups for various reasons that haven't been engaged within research. And so we have a working group that's titled the Canadian Spectrum Working Group, and they're tasked with making sure that we are developing inclusive mechanisms to bring in populations that are not part of what's been collected thus far, and to understand ways that we can make sure that that inclusion of populations that really represent the Canadian spectrum are being included as we move forward. So right now that group is doing an analysis of the gaps at each center. They're going center by center and identifying, based on where that center is located, who the gaps are from a population perspective and how they can make sure that that population is engaged. On the right-hand side of the screen, you'll also see the different cancer types. So right now, the network has not been prescriptive around cancer types. There hasn't been a directive to say we want X amount of cases to be part of a prostate or lung or breast cancer. We've opened it up to say, what data do you have? And then from this, we're now starting to see that we do have a lot of data in some categories, and it allows us to now apply funding to get data in other cancers that aren't necessarily represented. So as you can imagine, there has been a lot over the past several years of really trying to look and see what's available. And now we're moving into a phase where we're being more strategic about filling in the gaps that have been identified. One of the key pieces around the gold cohort that is a key factor for success is coming up with standards. We need data standards, we need policies as well, and we need procedures. So over the last 2 years, and I talked just a moment ago about the clinical data model, the discussion of a data model has been actually going on for over 3 years. We have gone through different iterations of this data model. We're on version 2, but I think it's actually probably something more like version 5, to be honest with you, because the data model, we're only able to learn about what changes need to happen for the data model as we're starting to interact with the data. So right now we're in a phase where we've understood that there's a need to now look more specifically at specific cancer type, and we call them liquid cancers, to look at how the data can be collected to extract the information that we need. Because as it's set up now, the data points aren't there, or if they're in the medical record, it's very difficult to draw a connection between, was this data collected pre-treatment for this treatment form? And you can understand the mapping and the detail that goes into it is quite extensive. Personally, I find that very interesting. It's a lot of complex problems, and sometimes it feels like you're not moving forward very quickly, but the changes and the work that are being done at this granular level, I would say, is a marker of success for how much work has been done. So on the screen, you'll see this is what we call the data pathway. So throughout the work, we've been able to look at the different stops on this data pathway. I will say, I'll sort of raise a caveat here. This data pathway looks quite good. It's definitely not complete. These are the main 4 areas that we have been working on, and there are many subcategories that are part of each. So in data generation, the example I just gave about the Canadian Spectrum Working Group, they're helping to inform recruitment and data collection, as an example. And there are a lot of different activities that we're starting to develop to help with the data generation. There's been a huge amount of work in data curation. I'm going to say for the last year specifically, this has been a big focus of the network. Although data exists at sites, and there are many different types of data and forms, the ability to take the data that's in a form, so it's a medical record, it might be an Excel file, and to put it into the MOHCCN standard actually involves a considerable amount of work. And whereas larger centers might have already done some of this work, just part of their research, smaller centers haven't. And so there's been a lot of effort put in place to help the smaller data centers. Data ingestion and sharing and utilization, the second part to this pathway, we have been doing work with, and this is where the digital health and discovery platform comes into play, because this is where we start to see the technology help to inform ways that you can ingest data or bring data into the platform. And then also it helps in saying, oh, well, we've just done an ingestion from a location, let's say Princess Margaret Hospital. They've provided us with data. And then when you ingest it, you see all these missing fields and you realize that there's been a problem in some of the data mapping. So that ingestion piece is a really important validation step, and it helps inform our data curation work as well. So although this looks like a linear pathway, we do have a back and forth across the pathway that we've been working with. So where we are now currently is, from an ingestion point, is working on what we call the Pathfinder project. And this has been the main technology piece for the Marathon of Hope Cancer Centers Network. So since that initiative is focused on data collection, this is the main piece that helps to inform, are we collecting the right data and are we doing it properly? I've put a quote on the screen about from Dr. Karen Cranston. So she is a member of the CANDIG team, and I'll show you a little bit about CANDIG in a couple of slides here. But she was involved in supporting the Pathfinder project and developing an ingestion tool. So doing a lot of the coding required, helping with the mapping. And one of the key pieces that she wanted to emphasize is that this is the first instance now where we have the option to search across data that exists at centers that are part of MOHCCN. So if you are a clinician, for example, in PEI, and you have a cancer patient or a cancer case that you have a very small number of that you've treated, say 5, and you want to understand, are there other treatment methods that have been applied to set with this cancer patient with these types of criteria, and you're able to now search across the country for data that might help inform treatment decisions. That's the key piece, and that's one of the starting points when we're thinking about precision medicine. So the ability to provide the right care to the patient at the right time. And so being able to do that from a data-informed perspective is one of the main outputs that the network is supporting. Okay, so that's the Marathon of Hope Cancer Centers Network. Now I'm going to transition a little bit, but still talk about the relationship between Marathon of Hope and the DHDP to now talk a bit more about the technology. And I will say that I'm quite fortunate in my role to work across both initiatives. And I think that that is an important piece when we're thinking about how technology can be developed and how it can use data when you have an opportunity to look at how data is being developed and the technology is being developed at the same time. It helps inform a lot of our processes, and it has been a really good collaboration to figure out how best we can support data sharing. So as I mentioned in the beginning, it's funded through, not through Health Canada, but through ISED, which is Innovation, Science and Economic Development Canada. And the funding for the development of this platform includes also bringing in a new collaboration to the table. Private and public sector collaborations to help support the development of this technology. And so what you would have and what the Marathon of Hope Cancer Center Network, MOHCCN individuals are familiar with is industry-sponsored research. So you might have a collaboration with an industry partner around a research project. They're interested in the outcome of that project, or perhaps something that's related to their product development. And you would have these types of collaborations. Here, we're bringing the development of a technology that has both private and public sector collaborations together, and helping to develop a platform that can share data around the country, across the country. There is a emphasis, though, on this type of project around innovation and commercialization. So this is another piece, and I'll talk a little bit more about private and public sector, or private and open source partners that are involved in this initiative. So really, what is the DHDP? So it is a platform. So there's a technology component, but there's also a network of individuals that are involved in it. So it's acknowledging that in order for us to move forward and help goals of sharing data, we need to have a way to do that through a platform. We need to have a platform that helps with ensuring that there's privacy protecting tools. We also need a platform that makes sure that the data stays within the institution that it's been collected in. So this is what we call federated access. So we're not sending data outside of any institution. The data stays there within the institution, but through the technology, a clinician or a researcher is able to ask a question, and that question is able to query the data and to look at the data across the country at all the institutions and return not the data, but return the results of those questions. In order to do that, we need to have policy innovations as well. So the data governance side, or the policy side, is a key part of this initiative. So we have a technology pillar for the platform, and we have a policy pillar, and both are working hand in hand to inform each other. So from a policy perspective, we're working with institutions, so hospitals and research centers, to understand what they need from privacy and security, and so that we make sure that it's part of the policies. And then the technology partners take those policies and they build the technologies accordingly, so that we know from a data access point of view, for example, that there are only approved users that would have access to data. We have a data access mechanism in place, as just an example. But part of this, in that collaboration with the public and private sectors, is we're really also all invested in using AI, or artificial intelligence, for healthcare innovation. And that's one of the central tenets that's part of the platform and the network. And that's what unifies a lot of the activities that are being supported. So as I mentioned, we want to unite the AI institutes. So part of the Digital Health and Discovery Platform, or DHDP, is we work with the AI institutes across Canada. So in Ontario, it's Vector. We also work with Mila and Amy. And what we have done is that we've developed a program which we call the AI Chairs program. And so we support the development of research around how we can use AI. And that involves collaborations with hospitals and researchers and industry partners. And so what we're trying to figure out is, what are these different collaborations that really facilitate precision medicine at the end of the day? So you'll see in the little arrows there, we have the DHDP, and we have an instance or a site activation. So we have a platform that we deploy at an institution. And what does that enable? That enables federated learning. So every time a platform is deployed at an institution, we have another connection that a user can access or query the data that exists at that institution. What we want to be facilitating is the treatment optimization. So we want to be able to enhance the number of cases or the types of data that a clinician can look at to make the best treatment decision. We also want to have a data governance framework, as I talked about earlier in the previous slide, to help make sure that data access is secure. And that also helps facilitate clinical care innovations, because we're able to use clinical data, real-time clinical data, and that's key and important. We also want to have network engagement. Again, back to the beginning when I said collaboration is a key component. This is what we support in this project and through the DHDP network. We want to develop researcher and industry tools. So these are technology tools that can help with the commercialization of discoveries. So this is the promise of the platform. I will say that also we view the platform as being an open marketplace. So we invite all individuals that maybe industry partners that have tools that could help support AI, machine learning applications, as well as other technology applications to connect to the network, or to the platform, sorry, and to be used by the network members. So this is a very, very simplified description of the DHDP. I'll show you another slide with a little bit more of a technical diagram to it. But this is a way that we have started to explain the way that you can use the platform. This was our starting point. Data is collected, it's added to the platform at the local institution, and then a researcher or clinician can request access for that data and they can complete their project. So that was our high level starting point when we started to describe this project, because as you can imagine, we needed a lot of buy-in and interest from those institutions and members that we were collaborating with. We then started to say, we need to have a little bit of a change in some of our infrastructure based on this. At the initiation of this project, we thought that we would be deploying on premises, so on-prem hardware, that we would have to have all of these investments done at the institution. Recently, we've been able to, because of an inclusion of new technical partners, change the way that we were approaching our infrastructure. We're now moving to cloud solutions. The structure still remains the same as it being a federated distribution, but we've also been able to work with multiple partners now that have been moving forward with their technologies as well, so that we reduce duplication and we make sure that there's interoperability. I think this is a key piece when we're thinking about technology development in Canada. I think collaboration is always there, but often there are the developments of little projects or pilots that happen, and then the ability to scale them or to expand them is not there. And so what we're trying to do with the technology itself here with the DHDP is make sure that we don't fall into those problems. So as I promised, this is a little bit more of a specific schematic about the platform. And I'm really sorry I wasn't able to also bring some of the technology partners to the conversation today. We recently had a change in some of our technology partners. And although we have signed our agreement with ICED to include these new technical partners, the announcement is actually going out a week today. So I will look for it, I would say, but then also I can share some more information about the technology partners if anybody is interested to in understanding that. But on this slide, I have some of the main points that I've talked about. But essentially, you can see that there's a platform. We have two different types of interfaces. One is when we're ingesting the data, and so that comes from clinical systems or research systems. We have a data lake, and that is one of the main pieces where we've also started to move to the cloud infrastructure. We have a way that we certify that information, where we keep auditing and records. We also have a way to categorize that information so that we have the proper permissions in place of who can access or not. And then we also have, this is where you see the pairing of the public from an open source code. So our CanDig partner is the technology partner that's contributing that open source code. And then we have private sector partners that are also involved within our system. We have a data access interface. And so when you're looking from top down, you can see a DHDP data user will only be able to access through the interface. And so that's where we're able to ensure that we have privacy and security within the first instance of interaction within the platform. I know that this might have some more technical information on this slide, I think sometimes one of the pieces when I'm presenting the DHDP to different users, I always would like to just show a platform and show a demonstration of it. I find that sometimes that's a little bit more effective. And I wish I could show a little bit more, but I will say that the DHDP website will have this information coming over the next month. So if you are curious too about some of the demonstration pieces, that will be made available. And also, what other work has been done to the DHDP today? So this is a very kind of high-level map of the country. And I want to talk a little bit about the Canadian Distributed Infrastructure for Genomics Platform, or CANDIG, as I've been calling them so far on the presentation today. So they're our open source partner. They're out of the University Health Network. And they have been working on developing a software tool that allows for the visualization of data for both genomic and clinical data. And so I talked a little bit ago about the Pathfinder project that the Marathon of Hope was working with CANDIG on. This is part of the DHDP as well. So you'll see the data ingestion logos that were part of the data pathway on the picture. Those that are bold are where we have deployments in place. So in BC, Ontario, and Quebec, we have software that is deployed. Genomic and clinical data has been ingested in this software, and it is able to be viewed and shared. There's still data access mechanisms that the Marathon of Hope Cancer Centers Network is working on finalizing, and those are those procedure pieces to enable that data sharing, but the data has been ingested. The lighter icons that are on the screen, and I know one is just showing one of the prairie provinces, but it's meant to represent all of the prairie provinces, show where we are starting our deployments. So every time that we have started a conversation around deployments, we've had to work with the IT departments at the institutions. We've had to develop a different configuration each time. As I mentioned in the beginning, there's a lot of variety across the country, and systems have been set up very differently. But where we are now is that we've actually learned different ways that we can respond to different IT systems. And so now we have almost a menu of options where we go to an institution and say, you can probably have one of these main configurations. This is the approach that we have done to develop a deployment for you. These technology pieces and the Pathfinder project has helped in data collection and support ingestion for the project itself, but we've also, from a technology perspective, had a lot of learnings, and there's been a refinement in the software, and there has been a lot of information shared across these activities, which has been extremely helpful. So one of the last pieces that I wanted to talk about is that once we have deployments in place, the initiative has funding that we give to develop, we call them demonstration projects. So this funds collaborations with researchers and clinicians to help find different ways to incorporate AI into the clinical setting. So we are also working with the AI institutes, and an example is a collaboration with Vector around the work that they do with industry partners in helping to have AI implemented into their systems. We're able to work with those same groups and help to look at different ways that we can have demonstrations in the clinical setting. I think it's really paramount now that we have demonstration projects or examples of how we can use this information. That only accelerates ideas and research into the future. But our priorities now are to come up with as many demonstration projects as we can to show the impact of this technology and the innovation. So that takes me to the end. I can also stop sharing and see if there's any questions as well, and so I can see faces, etc. But happy to put out any slides again if there's a question about specific information.
So first off, thank you, Natalie. That was beyond excellent. It's great to learn of all of these initiatives. One thing that I just wanted to point out, and this is sort of a ploy for our recordings that are online, is that you touched on a lot of things that we've already seen, and you may want to look back on some of these videos. You talked about data privacy and data governance. We have a session on that. You talked about synthetic data. You talked about asking the right questions with prompt engineering. So really, what you've shown, and I think it's so great, is just this interdisciplinary nature of big data and AI and how all of these different pieces can come together to help solve some of these real world problems. So I want to thank you for that. Um, Anybody who has questions, please feel free to raise your hand or put them in the chat. Let me ask one, Natalie. You talk about that 15,000 cases.
Mm.
And one of the questions that we often get as researchers is, how do you determine the right sample size? So what kind of went into this 15,000? Was it a self-selection? Was it an availability issue? Are you looking to expand that to a different number? Just trying to understand that.
Yeah, absolutely. So when the Marathon of Hope Cancer Centers Network was being formulated, it was involvement, as I mentioned before, collaboration between clinicians and researchers that were already collaborating. And they were coming together to see what would be a good sample size or representative cohort that would allow to start some of the evaluations. And I think there was a little bit of what data currently exists out there. There was also a question around what data could be captured that are both retrospective cases, so the data that exists, and then also prospective cases. So studies that could also be launched, and how much data would that accrue based on what the understandings were for instances of certain cancer types, how many patients were being seen. And so those were the two main pieces, I think, that went into that. I think, though, in all of the discussions, it has been that this number is the starting point.
Sure.
It's a starting point where there can be demonstration projects and proof points. The network also has 4 scientific questions that guide a lot of the decision making and work. And so those 4 questions were also linked to this starting point. The network, though, in a testament to all of the hard work that everyone has contributed, has already started to think ahead about what does the next phase of the network look like. And there's been conversations about bringing on different technologies around sequencing genomic material. There's also been conversations around enhancing how many data points are part of the clinical data set. So I don't know if it will be in the future a set number to say there would be an additional 50,000 cases, or if it starts to look at the type of information and enhancing what a case means. There's also that point I made too about inclusion and representation within the data set. And that's a key feature that the network is focused on right now, and I think will influence also what the next steps for the network would be.
Yeah, and I think that leads me to my next question. Any reliance on synthetic data creation for some of these really rare cancer types, or for some of these underrepresented groups? Is that something that will be explored? Is that something that still has some negative stigma attached?
Yeah, I think it's a really good question. And absolutely, the conversation around synthetic data has happened in several different instances. So an example about a recent one around synthetic data was the ability to look and see about what type of information exists within the platform without having data access to what that information looks like. And so one of the points that's been identified is to say, to support data scientists or support individuals that want to look at what data is available to test models, for example, maybe there should be a consideration of using synthetic data to help inform that piece, and then the access to the data request comes, and then you can run the model on the data. So that's one suggestion that's come forward. I think there's been a lot of questions, but absolutely, I think your point too about the use of synthetic data and what that means, and some concerns about what that could possibly influence has also been an undertone in some of those conversations. And so I think if people are trying to find the balance, and what would be the right balance, or what would be one way you could test that balance, for example.
Absolutely, yeah, and I mean, you know, we see a similar issue. I'm a accounting researcher here at the university, and again, we just have to. I think we have to explore that a little bit more to really get that buy-in and really see the value relevance. Um, so, any other questions that anybody wants to ask? We'll wait for them. I guess my last question, Natalie, is you talked a lot about data governance and the importance of having strategic frameworks and sharing and collaboration. You know, you talked about some of the challenges, and we saw this in a previous session as well, you know, in our healthcare system at the provincial, at the national level. Any plans to sort of expand this internationally? Is that a different data governance framework? Is that, you know, can we share information maybe with US? Any thoughts on where that's going?
Yeah, no, and also absolutely the question around international data sharing has also come up. There are certain structures or limitations that are part of some of the funding. For example, oh, bless you,
Bless you.
collecting data that's funded in Canada, for example, making sure that you can then make use of that data to help inform Canadian solutions is always highlighted as a priority. There are other international data sharing mechanisms that we've looked at that are also connected from some of the members of the network, and they've been used as examples to say, can we investigate what this international data sharing? So, for example, there's an initiative internationally, GA for GH, that is from a data governance perspective, investigating a passport mechanism. So users can be validated through a passport, and then their data sharing can be validated through the use of that passport. So I think there are examples internationally of ways that you can connect from a data governance point of view. Right now, the two initiatives are focused on specifically Canada, but I think in the future, that's going to be one of the pieces. If you're developing a technology, you want to make sure that you can have connections as that expands. And I think there's interest too, especially when you're thinking about treatment options, different clinical trials, where they're being run in the US versus Canada, for example, and how to start to bring that information across borders.
Sure, and then it's also a numbers game as well, right? I mean, US with 10 times as many,
Yes.
10 times as populous, of course. Um, and I guess last question, I think what we all really want to know is, you know, in your opinion, how can a student, what kind of skill sets does a student need to attain to make a real difference in these types of initiatives? Is it more coding? Is it more, I mean, you have a lot of certificates that I'm sure offer a ton of value to your day-to-day. Should our participants on this call be looking for some of these certifications? I think all of us really want to see purpose in what we do, and I think this would be an absolute great initiative to work in. Many of us would love to be a part of this. What are some of the skill sets that we need to set ourselves up for success?
Yeah, I think that's a really great question. Absolutely. And I think one of the things that I'm seeing, and an approach that I've used personally too, is looking across the spectrum as it relates to research, but then industry, and then looking at the different types of collaborations that can happen. So for example, and I'll just use a personal one. So one of my decisions to look at a certification in design thinking was that I was coming from a research environment where I was very familiar with clinical trials, how to run research initiatives, and I was part of a pan-Canadian project that was starting to look at developing a technology. And so I had to really quickly learn about coding. I had to learn about the language that's used when you're starting to work with technology partners, and design thinking came up. And so then I thought, okay, that's definitely a gap. I'm nowhere would consider myself an expert in that area, but what I was able to learn is more around the language, the way things are being described, so that if I'm in a conversation with a researcher and a clinician and a technology partner, I'm able to be that conduit between the conversation and put the context into both areas, and so that we can help get some answers. So I would encourage, from maybe if you're thinking individually about yourself and what you know, what your expertise is, maybe what your interest is, and looking at the other side to say, if I were working with, in a collaboration with clinicians or with privacy and security experts, what would I need to learn to just even have a conversation about a project together? And is there something specific I can do from a certification point of view? I think that also continues. I'm absolutely somebody that's continuing on that education line in all of the work. But I think that part has been what I've noticed to be helpful in these roles.
Certainly, and even getting a sense of appreciation of just how important all of these different roles are into reaching the end goal and the end outcome. Well, Natalie, thank you. This was a fantastic seminar. I really do appreciate it. Thank you, everybody, for joining. We have our next seminar scheduled for February the 14th. We hope to see everyone there. And if you ever have any ideas or any input on future seminar topics or future initiatives at the Big Data AI Hub, feel free to email or contact me or Simreed as well, who's actually on the call today. So with that said, thank you, everyone. Thank you, Natalie. And we look forward to seeing everybody February 14th.
That's great. Thank you. Thank you so much.